So next, we're going to walk you through some case examples of my own cases and Dr. McMillan's cases. The first case was an example of a proximal avulsion. This was a 28-year-old skier who presented to the office. The MRI had shown a proximal 1/3 tear. She did a course of PT, as all my patients do, for ACL prehab to regain the range of motion. And time to surgery in this case was 60 days. And on the left, you can see the arthroscopic image, which showed this to be more of a proximal avulsion type of injury. There was excellent ACL stump tissue remaining. And on the right shows what the ACL stump looked like after a modified Bunnell suture pattern had been placed up through the ACL and tensioned on the femoral side over a button. Second example is showing a mid-substance tear. So this was a 33-year-old female skier. Her MRI was obtained approximately 4 weeks after her injury. Also did a course of physical therapy prior to ACL surgery, and her time to surgery was 73 days. And this video shows, what a mid-substance type tear looked like at the time of arthroscopy. These do take a little bit more work to for the suturing of the ACL stump. But using the elongation techniques, as Dr. McMillan showed, you can get excellent control of that ACL stump. So in this example, I used a modified Bunnell type suture with an ultrabraid suture, passing it back and forth up through the stump. And even in this example, where at the initial scope, I put the camera and looked like there wasn't much tissue left to work with, you can see after working with that stump, you can almost get near approximation of the end of the tear back to the femoral wall. This is her at a 3-month visit. What we're finding is our patients have much less pain after surgery. Although initially we go a little slower with the range of motion, they catch up by the 2nd or 3rd week, getting already down to 90 degrees. And then this is her at 3 months. You can see the small size of the incisions as well. This is a third example. Also a mid-substance tear, 15-year-old high school soccer player who had a pivoting injury and hurt a pop. Her MRI showed a mid-substance tear. Time to surgery was 40 days in this example. At 9 months post-op, she had full range of motion, negative Lockman and pivot shift in the office. She passed her return to sport tests and was saying that her knee felt normal. And this is an example of her post-op MRI scan, which shows excellent restoration of that ACL tissue or mid-substance tear.
So case 4 is one of my patients, and this is a pretty neat patient. He's a 32-year-old professional fighter. And I think one of the take-home points with this is we learn a lot as we move on. And not only did he have a small stump, as you can be visualized here on his preoperative MRI, but he's someone who basically had determination, but also wasn't going to necessarily follow a slower protocol. And so, based on patients like this, we were able to sort of move forward with some more advanced rehab protocols just from understanding the dynamics around this. But again, this is a 32-year-old male who has a fight that he states he will not miss in 12 months. So you see his MRI here with a very small tibial stump that's left. 9 months out, here's his ACL. It looks really fantastic in this BEAR sequencing MRI. He was part of our BEAR 3 clinical trial. And one of the things that's important to note is, again, he accelerated his rehab very early on. He was bending the knee much more than even I was comfortable with in the first 2 weeks, 4 weeks, and 6 weeks. But he really focused on really strengthening up the knee and understanding, the right things to do with the knee kinematics in his rehab. Here it is again, a T2 image again showing that normal sagittal and coronal plane, rather, of the MRI and the T2. He ended up getting back to that fight. He ended up fighting at 10.5 months. He actually won his title, his first title. He's 4-0 since coming back from his BEAR ACL right now. And really, it's a testament to what you can do with good science and determination, as well as understanding how the body wants to heal itself if given the opportunity. The next case, though, is again pretty interesting here. This is a patient of mine, a collegiate soccer player. You can see the image on the left is her ACL tear. Again, you see a small stump there, maybe 50% left at most if you're lucky there. She went through again the BEAR clinical trial, BEAR 3 clinical trial. These are her 9-month MRIs in the center and on the far right. Again, seeing a good ACL that's intact and healthy. She again passed all of her post-surgical metrics to get back onto the field. And we let her back on the field with an ACL functional brace. And she was having a really good season. Next slide. And unfortunately, when we again went ahead, keep going there, Shawn. This was the day of her surgery. That's what the ACL looked like. Again, we were able to get a nice repair. This is viewing the ACL stump before we put it back up. You can see a nice, robust ACL that was left. And we were able to go ahead and tease that away and see this is more of a mid-substance proximal tear. There's her 9-month ACL post-op, as we showed before. And unfortunately, when she went back to play 18 months out, she took a pretty devastating valgus hit. She had a bucket handle meniscus tear, and obviously had to go into the knee, and concerned about the integrity of the ACL. But this is looking at it, and you can see the picture on the left. This is pretty common. When the ACL heals with a BEAR, there's a lot of extra synovium that'll sometimes overgrow in front of that ACL. Don't be scared by it. Don't be intimidated by it. Don't be concerned on the MRI. Understand that ACL is there. Do a good exam in the office. She had a negative Lockman test, a negative pivot shift, but again, the concern was there. What if it retore? So we teased away some of that scar tissue, and you can see that on the left there. And the picture on the right shows this nice, robust, healthy ACL that's there. I removed the previous ACL sutures that were there. And again, really nice, healthy looking ACL. So we felt really good about this, gave her a meniscal repair. I actually saw her back the other day. She's now 5 months removed from the bucket handle meniscus, and we're getting her back onto the field in an advanced protocol now. So it felt really good about the fact that the BEAR was able to take a pretty large valgus load to the knee, withstand a torn meniscus, and still able to do everything she needs to moving on. So this was really one of those moments where I said, geez, this thing's pretty darn strong, and I don't need to worry about this nearly as much as we might be concerned about otherwise. What was neat about this, though, was all along the ACL, we took biopsies when we went back at that 18-month follow-up, and we took it at the at the insertion site. We took it up by the femur, down by the tibia, and what came back to us, and we didn't speak to our pathologist, we just sent all these specimens off, was normal ACL tissue, right? So that was pretty important to me to see, not that this was sort of scar tissue that was in there. This is tissue that looked very similar all along the pathway of the ACL. So again, one of those things that sort of lit off a light bulb that, in fact, the body is healing and regenerating and restoring normal ACL functional tissue, which to me means that there's longevity that's going to be inside that ACL moving forward.